Hi and welcome to this video log with me, Wayne, from swimmingcyclingrunning.com. Well, today you can see I'm in a completely new place, and that's because I'm not alone. I'm with Shelley. And this is Shelley. We've been married for about 34 years, and recently she's been having trouble with one hip that's led to her requiring hip replacement surgery. And the problem was that when we looked on the internet, or when she looked on the internet, trying to find information about the recovery process, she found virtually nothing from the patient's perspective. And she really wanted to tell you, or give you a clue, what it's like to actually have the surgery and go through the recovery process. So I'm going to go over to Shelley now so that she can explain exactly what's happened and introduce herself to you.
Hi, I'm Shelley. I'm 59 years old. And until June of this year, I would have considered myself to be a pretty healthy person. I run 4 or 5 times a week. I do a 3K or a 5K. I'm not fast, but I'm consistent. I do Pilates classes, both mat and reformer, and I do bar classes. So I was really shocked when I discovered that I had a problem with my hip.
Okay, that's great. What's the history of the problem that you had and what sort of symptoms you had? If you take people through that, it might help them.
Okay, so in June of this year, it started by when I sat down. When I stood up, my hip was stuck in the same position as if I was still sitting. And before I could move from there, I had to wait for it to go back into position. In between times, I was fine. I was still running, I was still doing all my classes. I wasn't affected at all, but every time I sat down, it got stuck. And if I went out for dinner, for example, and it was a long dinner, by the end, it was almost like it had seized up. I couldn't cross my legs because I actually couldn't lift my leg, my left leg at all, to cross them over. So I gave it about 3 to 4 weeks, and then I decided to go and see the specialist. I had an X-ray which showed nothing, and then I had an MRI. The MRI showed some wear and tear in my right hip, and then some in my left hip as well. Not dramatic, that the specialist didn't think, but there was some there. And his suggestion was the first course was to do what they call a cortisone injection. So for the cortisone injection, I went into the hospital, and it was given to me by a specialist. I didn't need to be knocked out or anything. I just had a local anaesthetic in my hip, and they do it straight into the joint of the hip. This was in mid-July. At first, absolutely, it didn't get better. In fact, it got worse. Whereas before, the only problem I'd had was sitting down, I now found that every time I walked up the stairs, my hip actually crunched, and it was really disconcerting. That went on for about 10 days, and then we went away, and whether it was a combination of the injection and the heat, but I suddenly started to notice that the incidence of my hip getting stuck were less and less. After about 2 weeks, I suddenly realised actually it wasn't happening at all. We were on holiday, I was windsurfing, I was swimming in the sea, I was walking along the beach, no problem at all. After about 4 weeks, the pain started to come back, but it was totally different. So I was really confused. I wasn't getting stuck anymore, but I was just in pain. I couldn't walk, I started to limp. I couldn't lift my leg at all, and I couldn't do my classes anymore. I couldn't run because it just sort of collapsed on me. I went back to the specialist, and he said because the first injection had worked, we should try a second injection. So I went in and had the second injection, exactly the same procedure as the first, absolutely no effect at all. I waited and waited, but nothing happened. And by then, and I know it doesn't seem very long, and the specialist has said to me, you know, we normally like to wait a while before we do surgery or what have you, but I had decided at that point to definitely have surgery. So this was the middle of October, so it had been since the middle of June. So the specialist told me rather than going straight to surgery, he would like to try one other thing, and this was the same injection, but I would go into the theatre, I would be knocked out, have a general anaesthetic. He would put dye into my hip so he could see exactly what was happening, and he would inject it himself. And he said this way we would know that the injection had actually gone into exactly the right place, so we would be able to judge it. So I had this done in the middle of October, and at the end of October, the 25th of October, I was due to travel to the States. So with an 11-hour flight to America, it was a bit of a challenge. I discovered that my hip wasn't getting stuck, but I couldn't bend it. So I couldn't sit down easily in the seat. Once I had sat down, I couldn't bend forward to get my stuff out from my bag or what have you. It was a long journey and it was a real challenge. But anyway, I did get there. When I got to Austin, the weather is lovely, it was warm, and the hip did start to improve a bit. But nevertheless, I still found bending down, so if I wanted to put my socks on, it could be really difficult. Sometimes I couldn't put them on at all. If I walked for a long while, afterwards I would be in real pain and I would sit on the floor and try to stretch it out and see if it would make a difference. So when I got back from Austin, I was still of the opinion I definitely wanted to have the operation. I went to see the specialist, and unfortunately he told me that after a cortisone injection you can't have an operation for 12 weeks, which I had not realised. And that made me really depressed because I just had enough. He also told me that normally they like to leave it for a while and not operate straight away. But for me, this is no life. I've stopped going to the gym totally. I struggle to go to the supermarket. Getting in and out of my car is a nightmare. I would go to the supermarket and then find I couldn't get back in my car to come home. I'd have to move the seat back as far as I can and then lift my leg into the car. Luckily enough, I've got an automatic, so at least, and it's my left leg, so at least I could drive. But all of these things became a real challenge.
Okay, so were there any real defining moments for you that made your mind up that, hang on a second, I don't want this, I've got to go through surgery?
So there was the time in the gym where I went to the gym and I was just walking on the treadmill and I thought I was okay. I went down to the changing room to get ready and I discovered I could not put my shoes and socks on. I just could not bend over far enough to do it. And so I had to sort of put my feet into my trainers, but with the backs down, and shuffle out to the restaurant and then get my husband to help me. I mean, I was in floods of tears. I did do two things that you might find helpful. I used a TENS machine, which really did help to ease the pain, and I've used a wheat bag which you can heat up in the microwave and put that on it as well, and both of those things have helped me.
Okay, so you've decided to have the operation. Take us through the process of the interaction you had with your surgeon and what he said the process is going to be, etc.
So when I saw the surgeon, he did say to me, we like to wait a bit, and I was adamant I didn't want to wait. I wanted to go ahead. I wanted to do the surgery as soon as possible. So we agreed on a date of the 16th of December, which is next Monday. At the time, actually the pain wasn't as bad as it is now. I thought that last injection hadn't worked at all, but now I actually think it had worked to some degree, and now I am much worse than I was even then. I don't leave the house unless I really, really have to. I find everything very difficult, and for somebody who is normally very upbeat, I've actually found myself quite depressed because not being able to go out and not being able to do things, not being able to go to the gym when that's always been such a big part of my life has been really difficult. So I never thought I'd say it, but actually I'm really looking forward to having surgery on Monday because I really want this to be over.
So the surgery is Monday, 4 days' time. We're going to take everyone through both the surgery, we can't actually go in obviously the operating theatre, and the recovery process. So we're going to do all of that for you and exactly what it feels like and how it is. Give us your thoughts now about the upcoming surgery and what you hope to immediately have and how long you think it's going to take to actually recover.
So on Tuesday of this week I went for what they call the pre-assessment, where they did all the blood tests, they checked for MRSA, they checked my heart to make sure that I was fit to have surgery. And I also had half an hour session with the physiotherapist, which I thought was really, really useful. So she talked to me about what they're going to do after surgery. So I'll be in hospital for 3 nights, and every day I'll have a physiotherapy session and I'll get in the hydro pool, which strangely enough I'm very excited about because I really believe these things will help. They've said that for the first 6 weeks You'll be walking with sticks, maybe 2 to begin with and then maybe 1. You need to be careful how you sit down. You mustn't cross your legs. You mustn't take your injured leg past the midpoint of your body, because there is a small risk of displacing your hip. And then they've said when you leave hospital, you'll be given exercises to do that you have to do every day, and probably physiotherapy once a week. And the total recovery time will be, so they've said, is 12 weeks. But what I couldn't find was really anything on the internet that really details this. And what I want to do is detail this for you step by step, so that actually you can understand what it will really mean to you in true terms.
Okay, so we're going to take that, and this is going to be like you doing the exercises as well. That's what you want to show. You want to show the physio exercises. You want to show literally the pain of recovery and the joys of recovery.
Yeah, and the improvement. So you can see that at 2 weeks, will you be able to move? Will you be able to walk? How do you get in and out of a car? Does it feel okay? And then at 3 weeks and 4 weeks, so you can really understand it, because I found it really difficult to understand what stage will I be at each of these points, to know what I'm going to be doing, what I should be focusing on, how I can plan for after surgery.
Okay, so that's it. Surgery is on Monday. We will be doing perhaps 1 or 2 videos on exercises that have been done post or pre-operation. But as of now, there's a 4-day countdown to surgery. We will see you in the hospital in Spire Bushy, and we'll take you through the whole way through. Hopefully it'll help you if you are in this situation and are thinking about or are actually planning hip surgery for yourself. Okay, so it's a bye from me at the moment, and
bye from me.
Okay, hopefully we'll see you next week. If you are training, enjoy it. Enjoy your weekend. It's a bit wet out there. Keep well. Thank you.